A 65-year-old man comes to his physician for a follow-up. 5 years ago, he had a prosthetic placed into his heart due to retrograde flow. A normal chest x-ray is shown with the corresponding structure shown with the red circles. If this patient had not been treated for his condition, which of the following would most likely directly result? Choice A, left ventricular dilation. Choice B, dysphagia. Choice C, jugular venous distension. Choice D, left to right shunting. Or choice E, continuous machine-like murmur on auscultation. And of course, I have this image of the CXR, both frontal and lateral views. You do want to look at them for this particular question. And I'll wait 5 seconds and then answer this question. USMLA does not expect you to be some kind of expert radiologist for the most part. However, one thing they have tested quite a few times is for you to be able to identify the basic anatomy of the heart on chest x-ray. So you need to know where the left and right atrium are. You need to know where the left and right ventricles are, and therefore you need to know where the valves of the heart are, at least approximately. Now, in this particular case, I drew the circles on this image, meaning for them to be circling the mitral valve. Now, I'll come back to whether or not I drew them accurately in a minute here, but just sticking with that for a second, that this is the mitral valve. When you think mitral valve regurgitation, the first thing you want to consider is, of course, left atrial dilation over time. And of course, you also need to know basic anatomy. Left atrium is the posterior most chamber of the heart. So when it enlarges, something that can happen is that it compresses on the posterior lying structures, specifically the esophagus, which can lead to dysphagia. Choice B is the correct answer. Now I'm going to put up an image here that points out the rough locations of each of the valves of the heart here. Now, I know some of you look at these images and you're like, I have no idea what I'm looking at. I'll just give up on CXRs and any image related questions. However, let me give you some basics that you can at least try to get, I would say, most of these questions right. So let's just go back to the basics of what the heart looks like in the actual body, right? Here's the rough rule, okay? The right atrium is on the right side, the right ventricle is anterior, the left ventricle is on the left, and the left atrium is in the posterior. With that in mind, you can kind of draw rough locations of these chambers, and then, of course, knowing your basic anatomy, you know roughly where the valves are as well. And of course, just to review real quick for those of you who are really bad at your anatomy for some reason. Of course, the tricuspid valve is between the right atrium and ventricle. Mitral valve is between the left atrium and left ventricle. Pulmonary valve, of course, comes out of the right ventricle, and the aorta comes out of the left ventricle. Now, I want you to look at the image I put up for the answer explanation here. Let's take the tricuspid valve, for example, from the frontal view. If you imagine the right atrium being on the right side of the heart and the right ventricle being on the front of the heart, well, doesn't it make complete sense that the tricuspid valve is where it is? It looks like it's at the connection point between the right side of the heart and the front side of the heart, which is where we know the right atrium and right ventricle are. Same thing with the mitral valve. Well, we know the left atrium is in the posterior location and the left ventricle is in the left side. So it doesn't make sense. It's kind of centrally located off to the left a little bit. And by that same token, if you look at it from the lateral view, you can see that the mitral valve is way in the posterior of the heart, which makes sense, right? Because the mitral valve is between the left atrium, which is in the posterior of the heart, and the left ventricle, which is on the left side of the heart. And as far as the aorta goes, people like to say that the aorta is kind of like perfectly in the middle from the frontal view in a way. And it's kind of in a similar position on the lateral view as well, but you can kind of imagine almost the left ventricle being on the left side, or just kind of in the middle view from the lateral view. And if you try to visualize it in 3 dimensions, you can almost see that the aorta is coming out of the top of the left ventricle, right? And the pulmonary artery, well, we know that the right ventricle is on the front of the heart and it's kind of pumping away from the right ventricle into the lungs. So its position also kind of makes sense being where it is. Now, taking that and coming back to the way I drew the red circles on the actual question, you can see from the frontal view, I drew the red circle kind of to the left a little bit of the sternum, not quite exactly in the middle, which is where the aorta is typically placed. And more importantly, if you look at the lateral view, I put the red circle way in the posterior of the heart, which makes more sense because that's where the mitral valve tends to be, moving from the left atrium, which is in the posterior of the heart, to the left ventricle, which is on the left side of the heart. Now, some of you might argue with me and say that, well, the way I drew them technically could still be the aorta. Look, if you want to say my art skills suck, then I'm not going to argue against you, that maybe you're right. What I want to impress on you is the general location of these structures. And in fact, a lot of NBME questions ask easier questions than this. There's actually a couple NBME questions which basically boil down to them asking you, where is the right ventricle? They don't ask it in those words, but they'll show you something at the very front of the heart, and you're supposed to surmise, oh yeah, that's where the right ventricle is, because that's the front of the heart. So again, it's more about you understanding the general location of these structures within the body, within like an actual image of a CXR. Because that's pretty important. You need to know where the structures are when you're looking at something as basic as a CXR. All right, I know that was kind of a lot, but let's come back to this question and look at some of the wrong answer choices here, okay? Choice A, left ventricular dilation. This is more likely to result from aortic regurgitation. Obviously, retrograde flow through the aorta will cause a constant volume overload in the left ventricle, and over time, the left ventricle is going to dilate to compensate. The technical term you hear a lot being, of course, eccentric hypertrophy or sarcomeres being added in series, and it causes a dilated heart. And once again, if I wanted to indicate the aorta on a CXR for the frontal view, I would have placed it more in kind of the exact middle almost, and very similarly on the lateral view, it would also be more anterior than where I placed it on this image. Choice C, jugular venous distension. This is the result of right cardiac failure or right-sided heart failure. Obviously, it backs up into your jugular vein and you get jugular venous distension. I mean, I think you can argue with me over whether or not I drew the circle to mean mitral valve or aorta, but there's no way for you to argue that this is the tricuspid valve or the pulmonary valve, in my opinion. Now, some of you will correctly point out that a left-sided heart failure can eventually lead to JVD if it backs up into the lungs and then backs up into the right heart and then eventually backs up into JVD. Of course, that can happen, congestive heart failure, but you obviously just have a much better answer choice here, right? So even though this is technically an answer that can apply, it doesn't apply because the question asks directly result, so it's not the best answer. Choice D, left to right shunting. This can refer to a number of different things. It can refer to a septal defect, whether it's atrial septal defect or ventricular septal defect, either one. A patent foramen ovale or a patent ductus arteriosus are all left to right shunts. Now, as far as CXR question goes, they're not going to expect you to be able to identify the ventricles on a CXR. I don't think that's ever been a thing, let alone a PDA. I don't think you can directly visualize that on a CXR at all. You can correct me if I'm wrong on that. Whatever case, it's not a good answer choice here. Choice E, continuous machine-like murmur and auscultation. This is referring to a PDA, patent ductus arteriosus, which is kind of a subset of choice D. It's just commonly described as a continuous machine-like murmur. Sometimes it's described as a to and fro murmur. That's another term that comes up once in a while. Like I just said, you can't really directly visualize a PDA on CXR, so it's just not an answer choice worth thinking about. So bring it back. I mean, CXR, being able to identify basic heart structures is one of the few things about radiology they do expect you to know on step one. This kind of question has shown up quite a few times on NBME, and like I said, you just gotta remember basic anatomy. Okay, right atrium on the right side, right ventricle on the front, left ventricle on the left, and left atrium in the posterior. And they also like you to know that the left atrium is the chamber closest to the posterior lying structures like the esophagus. So if you get a left atrial dilation or something, you can get dysphagia because it's compressing on the esophagus. I hope you found this video helpful. I'll see you in the next one.